Assalamualaikum everyone. My name is Afifa binti Arif Nizam. My matric number is 2023400882. I am from CAFF 236. Now, this speech will discuss to inform my audience about the disease that can cause Proteus syndrome and the characteristic found in this disease. What is Proteus syndrome? Proteus syndrome is very rare genetic disease characterized by the overgrowth of certain part of your body. The condition can affect your bones, tissue, organ and skins, and it causes portion of body to grow asymmetrically. A mutation in your AKT1 gene causes Proteus syndrome. This gene helps control cell growth and divisions. Did you guys want to know more about Proteus syndrome? The atypical growth starts to appear between the age of 6 months and 18 months. It rapidly develops within 10 years and gets more severe or as young as. Along with difference in your physical appearance, some people with Proteus might experience neurological issue. This is the body shape of the person suffering from this disease. The first picture is asymmetry chest, abdomen and kyphoscoliosis. The second picture is enlarged right hand, and last picture is lymphoma nape of neck. This disease is taken from the story of a severe disabled man in late 19th century London known as Joseph Merrick. Joseph Merrick was apparently normal until about the age of 5, when he began showing signs of a strange disorder that caused abnormal growth of much of his skin and bones. The size of his head increases to 3 feet, almost 1 meter, in circumference, with spongy skin hanging from the back of his hand and across his face. Deformation of the jaw rendered him incapable of showing facial expression or speaking clearly. Although his left arm was normal, his right arm ended in rise that was 5 inches in circumference and a fine light hand. His legs was deformed in the same manner as his arm, and a defective hip causes such lameness. The Joseph Merrick worked only with the aid of a stick. In addition, firstly I will talk about characteristics found in the disease. The first main idea is patients tend to show a unique pattern of skeletal abnormalities. Second, affected patients typically have localized periarticular limb distortion, limb legs discrepancy and spinal deformity. And the last, patient may also show cranial deformation in the form of dolls, corpusally of elongated skull and facial abnormalities. Where that we will find people with Proteus syndrome. The prevalence of Proteus syndrome is extremely rare, with an estimated incidence of approximately 1 in 1 million individuals worldwide. This genetic disorder causes abnormal tissue growth, leading to various physical manifestations such as overgrowth of bones, skin, and other tissues. The condition is characterized by progressive and unpredictable changes, making it challenging to diagnose or manage due to its rarity. Proteus syndrome remains a highly uncommon disorder affecting a very small number of individuals globally. In this graph, the y-axis can be considered the fraction of undiagnosed patients. This is table of case. This case satisfies the criteria. Patient here was having score 17.0. Next, I will talk about internal features and external features of Proteus syndrome. Internal features of Proteus syndrome: 1. Asymmetrical overgrowth, such as one side of the body having longer limbs than the other. 2. The disease causes deformities and mental characteristics such as a long and narrow face, drooping eyelids, and wide nostrils. External features of Proteus syndrome: 1. Feeling awkward in public, sometimes shy. 2. Proteus syndrome can also put pressure on organ and nerve, and result is collapsed lungs and loss of sensation in limbs. Given the severity of this disease, I am sure you are wondering how it can be treated. This is main steps in Proteus syndrome. First step, the doctor will perform a biopsy of the tumor or tissue and test the sample for the presence of the mutated AKT1 gene. Second step, if found, the hospital or clinic needs to do screening tests such as X-ray, ultrasound, and CT scans because they can be used to find internal masses. In conclusion, after doing research on this disease, I can conclude the Proteus syndrome affects the life of the patient because there is no cure and the disease can only be treated. In addition, there are treatment measures to address the symptoms of the disorder and help prevent this disease. Some patients also take medication to reduce the pain associated with this condition and to treat inflammation and infection that may arise as a result of Proteus syndrome. That's all from me. Thank you.